Today, we are joined by Ms. Heather Martin and Drs. Darlene Traffanstedt and Sue Feldman to discuss the Alabama Health Professions Opioid Education, a statewide initiative to create an interdisciplinary substance use disorder and pain management curriculum for Alabama health profession students. Known as ALAHOPE, this is a topic on which they recently published in the Southern Medical Journal. Thank you all for being here today.
Thank you for having us.
Although Alabama's opioid dispensing rate has declined over the past, it is still considered to be one of the highest in the country. Why do you believe that is?
I'll take that one. We know that Alabama remains the highest opioid dispensing state in the country, but I want the viewers and listeners to know that we have made significant improvements in Alabama. So in 2012, we reached a peak of 143.8 prescriptions for every 100 people in our state. And the most recent data that is available is for 2020, where that number has fallen to 80.4 opioid prescriptions dispensed for every 100 people in our state. And so you can see that we've made great strides, but we still have a long way to go. I know there are many organizations around our state that have focused on prescriber education. Our organized medicine, our regulatory boards, academics, and I think that has made a huge difference. We've also had our regulatory boards implement risk and abuse mitigation strategies that really guide prescribers how to more safely prescribe opioid and other addictive substances. So really proud of the improvement we have in the state, but know that there's a long way to go.
Could you describe what the ALAHOPE project is and what it hopes to accomplish?
I'll take this one. ALAHOPE stands for Alabama Health Professionals Opioid and Pain Management Education. So our goal for this project is to develop an asynchronous multimedia online opioid prescribing and dispensing practice curriculum that can be used by all health professional students in the state of Alabama. And that means our target learners include those who are in school to become our future physicians, osteopaths, nurse practitioners, physician assistants, pharmacists, dentists, optometrists, physical therapists, occupational therapists, and our social workers. We're taking a multidisciplinary approach to this project, ALAHOPE, where these different types of health professionals work together when treating a patient that has substance use disorder and/or pain, because there's evidence this type of approach leads to better patient outcomes. We've worked with many academic stakeholders and subject matter experts around the state to help determine the curriculum content for ALAHOPE. It has been organized based on this feedback into standalone lectures, such as barriers to use, to substance use disorder, or stigma and language. And those types of lectures can be handpicked and easily integrated into any health professional school's current course outline. The best thing about ALAHOPE for me is that it's free for these health professional schools to use, and it's also being scaled for free for CME credit for different types of health professionals in our state.
I really honed in on the multidisciplinary. I think that's so important as you're involving the multi-team. It's not just the physicians, it's not just one aspect of healthcare. And with this being such a predominant thing that we're hearing about it, I think that's important to bring in all aspects of the healthcare team. So I think that's a huge benefit to this. How does such an initiative benefit and result in a consistent substance use disorder and pain management curriculum?
So I'll take this one. The benefit of implementing the ALAHOPE curricula is to provide consistent and unbiased knowledge for adult learners, specifically disorder and pain management. Until now, unlike other states, the state of Alabama has not had any consistent and standardized curricula for students of the health professions, such as nursing, medicine, OT, PT, dentistry. There's a whole host of them. That is not to say that this content was not being taught, but rather that each program was responsible for developing and teaching content-specific material. Typically, the curricula and health professions programs are packed, and instructors say that there's not enough resources or the requisite breadth and depth of expertise to develop and teach this type of information. Before developing the content for ALAHOPE, we conducted a rigorous external content analysis of other programs across the US. And the details of our findings can be found in our paper published in the January 2023 issue of Southern Medical Journal, authored by Martin, Traffanstedt, and Feldman. ALAHOPE is a comprehensive substance use disorder and pain management curricula funded by the Jefferson County Department of Health and was developed with the guidance of substance use disorder and pain management experts across the state to provide all students in any schools of health professions in Alabama a modular, self-guided, unbiased environment within which to learn about substance use disorder and pain management. Additionally, ALAHOPE was designed to provide education beyond current students and to contribute to the ongoing learning of those who are practicing health professionals. So ALAHOPE also offers continuing education credits for a variety of licensures, including social work.
This next question is going to be kind of a two-part, but in your findings as you undertook this project, what are some of the things that you found most surprising and why? And then also, have you seen changes in behaviors and learning as a result of this? You can just kind of take that apart as you would like. I know I kind of added some things in there, but just hearing you discuss all of this, I'm just thinking this is just has such far-reaching positive implications for medical education. And I was just hoping you could share some thoughts.
I can take this one. On your second question, it has actually not been rolled out yet. We're hoping to roll it out next month, so in the middle of spring semester. We do have evaluation credits, evaluation questions for RCME credits attached to it, so we will be able to impact the change of knowledge for our health professional students, and hopefully our practitioners that take it for CME credit also. For your first question, what did I find most surprising about this project? In the paper that Dr. Feldman was just talking about, that was published in January in Southern Medical Journal, in that analysis, we were surprised to find that when we looked at these other curricula around the country that were teaching similar topics, and most of them, they did not stand alone teach just about substance use disorder or just about pain management. They always coupled the two in all or at least part of their curriculum. And I think that really speaks to the fact that these patients that have either substance use disorder or pain, they need to be treated for both. And that's what we strove to teach in this curriculum. And the other thing I've personally found, recently have found very surprising is that the difficulty of balancing the long length of time it takes to create a project of this scale and the frequently changing political landscape around prescribing controlled substances in Alabama. So one of our team members, Matt Hart, who's on our special counsel to the executive director at the Alabama State Board of Medical Examiners, he's helping us navigate these policy changes with our curriculum. We're putting reminders in our curriculum that the learners need to frequently check on those policy updates and be aware of them so they can have the most up-to-date education possible around substance use disorder and prescribing controlled substances for pain.
When I was saying that, I was trying to say piloting this program, so I hope to clarify, and that just didn't come out quite the way I intended, so I do apologize. But you touched on something just now, you know, the changes and how it's been kind of a learning. Trying to develop a program such as this is almost a separate learning project in and of itself, isn't it? I mean, you realize just what goes into something like this and the efforts and the involvement that it can take, but obviously this is going to be something that's incredibly worthwhile and beneficial. Dr. Feldman or Traffanstedt, is there anything you would like to kind of dovetail with what Ms. Martin said?
Yeah, I think I would just like to add just how many people have been involved in this process. So this work was actually created out of the Alabama Opioid Overdose and Addiction Council, the Prescribers and Dispensers Committee of that council, which when it was established by our governor in 2017, had 5 major strategies that we were looking to accomplish. And one of those was to ensure that tomorrow's prescribers are educated in safe opioid prescribing while they're in their health professions program. And so that group is about 50 individuals who are on regulatory board leadership. They are educators in our various schools of health professions around the state. And then in addition to that group of people, we've had this amazing group of subject matter experts. So without Heather and Dr. Feldman, this project would not have been able to be accomplished, and they have worked extremely hard, as well as other members of their team in the School of Health Professions, to help us get this project to completion. We've had an amazing instructional designer, Dr. Laura McNeil from the University of Alabama, who's helped us put together the multimedia nature of this content so that it engages the learner. So I just want to say, publicly, thank you to all of the, probably more than 100 people by the time it's all said and done, including our colleagues over at Auburn University who are hosting the content on their learning management system. So really a true rare collaborative effort across our state of academics, experts, regulatory boards, and just really pleased to see this come to completion.
Dr. Feldman, is there anything you would like to add?
I think any comments that I would have would be echoes of my colleagues. I think it's just, for me personally, it's been an incredible project. Just contributing, being able to contribute to something that contributes to the landscape of the state education across all schools of health professions. Just, I know it sounds like a cliche, but it just makes me feel really good, to be able to contribute something high impact that will influence way beyond the learning environment. It is like, that's a career maker right there. That kind of project is a career, and that's what this project has been. It's been great.
Well, and Jennifer, I know y'all's listeners and viewers are more broad than the state of Alabama. So this content will have national continuing education accreditation. So if you have listeners that are in another state that need AMA Category 1 CME, they will be able to access this content once it's live and take advantage as well. So we would encourage those from other states where there are not similar opportunities to access the curriculum.
That is wonderful. And I would like to just make a note to our listeners that once that is rolled out and live, we will be happy to share that link with our listeners, and we can put that as part of the podcast information as an update as things become available. I think this is an incredibly important resource. And honestly, it's nice, sometimes Alabama, just kind of a little editorial opinion here, sometimes Alabama is often in the news for things such as sports or not such great news or events, and so I think this does a huge service to not only Alabama, but as you just said, nationally, and the landscape across the country of how this can affect and change lives. So I think it's very proud. I'm proud to be from this state to see where such a great project has begun, has been developed, and will hopefully make a difference very, very soon. So before we conclude the discussion, I would like to just ask each of you, what is the most important thing you would like our listeners to know? Piece of advice, pearl of wisdom, something like that. I would love to get each of you to share just something along those lines.
So I'll go first. Being in the classroom myself, I know how hard it is to fit new content into my current syllabi. Right? There's always something new that needs to be taught, always something important. I think for ALAHOPE and for the instructors who might be listening to this, I think it's critically important that they realize that this curricula is modular, it's unbiased, and it's self-guided. So it does not necessarily need to be folded into the classroom, but rather it can be used as an out of the classroom assignment, a homework assignment, or something like that. I think having students work through the modules will greatly enhance their knowledge around substance use disorder and pain management without sacrificing already impacted and very precious classroom teaching time. And I think that that's a critical thing that ALAHOPE brings to a classroom environment.
I can go next. For me, the most important thing that I want people to take away from this podcast about ALAHOPE is that different types of health professionals that treat people with substance use disorder and or pain have really got to work together to get the best outcomes for those patients. And ALAHOPE is just one tool that we can use to train our next generation of healthcare professionals and our current healthcare professionals who treat those types of patients. One tool that they can use to be able to learn about how to do that in a multidisciplinary way.
And I'll just close by saying that we've designed this to be very user-friendly. There are 15 to 30-minute modules, very engaging for the learner, videos incorporated, and a lot of things that the learner has to move around to do. So these are not just 15-minute lectures, didactic sessions where you have to listen to a speaker. These are engaging multimedia, really user-friendly modules that are short and rich with content, but meant to be efficient for the learner as well. So we just hope that that it's really found to be beneficial and all free to the user. So the academic programs and the professional user can access all of this content for free.
I thank you so much for being here in just such a brief amount of time. I think we have covered something that is incredibly important, that is going to have a huge impact on learners. And again, I'll just say the multidisciplinary interprofessional approach. I mean, from a Southern medical aspect, that is our goal, is to provide multidisciplinary interprofessional education to improve the quality of patient care. So to me, this touches right on. And when I saw the article come through the journal, because I also serve as the managing editor of the journal, so I'm always looking for things, and I saw this, and seeing such innovation come out of our backyard here in Alabama, but knowing that it does reach, as we discussed, far beyond Alabama, the South, but nationwide. I think you should be commended for the work that you have done. And I appreciate you all being here today.
Well, thank you very much for having us.
Thank you.
Thank you very much.